Hey guys, welcome to episode 2. And this is going to be an interesting one because today we are going to talk about sleep and your oral health. And of course, we have the wonderful Dr. Tembeka Buleni with us, and she's going to basically educate us and tell us why sleep affects our oral health, because I know it's a very not spoken about thing, and it's weird that actually sleeping can affect your mouth because nobody ever thought of that. But one thing we're starting to notice is that these days your oral health is actually affected by a lot of things. If you didn't watch our previous episode where we spoke about stress, yes, stress literally affecting your oral health, then you need to go watch that. But today we're going to talk about sleep and your oral health. So before we start, I just want to ask Dr. Buleni, how are you? Are you doing well? And how has the practice been? And how have the patients been for you?
Hi, Venan. All is well. I'm well. Hi, everyone. And thank you for joining in.
Yeah, no, that's great. So I'm gonna open with this question, right? And this question says, most people don't think about their dentist when they think about sleep. Why should they? Why is a dentist very important to think about when you think about sleep?
Uh, I really think that people don't think about dentists when they sleep because most of the time people associate dentistry with tooth extraction. Like when there's toothache, then I go to the dentist. But they have no understanding of the overall oral health or dental health, you know.
Hmm.
But your sleep has so many effects on your dental health.
Yeah, no, that's true. And then have you ever met a patient that basically had sleeping problems, and then you could literally see the effects that it had on their oral health? And if so, like, what are those effects?
For us, we would see that by the grinding of the teeth. You see that this person has a problem with sleep and it's
Yeah.
affecting their teeth. You like I spoke about the marks on the tongue as well last time because the tongue is so pressed against the teeth that it makes marks, you know. Um,
Yeah.
so you will see that definitely. And some people will talk about their restorations keep on coming off because they grind so much that they agitate the restoration or the filling until it comes out. And some would be
Mm,
like, normally when I wake up, I have headaches, mild headaches, but as the day goes by, gets better. Some are complaining of muscle tenderness. They'll be like, oh, some pain here, some pain here or here. Um, or
mm,
some will say, okay, I have obviously the bad breath because when they are sleeping, they're opening their mouth. You know what?
yeah.
You know how you check that you're opening your mouth when you're sleeping? When you wake up and you have that that white thing like dropping
Yeah.
down, definitely just know that with that one you are definitely opening your mouth when you're sleeping. For some, obviously, I would say when the jaw is more like retruded, like more on the inside, like like
Yeah.
yeah. So with those people, because they've got retruded jaw, they'll definitely have any some sleep apnea issues
Mm,
or mouth breathing, yeah.
okay. And is there like a connection between snoring and oral health? Like, do those two connect, or is it just a myth?
Yes and no. I mean, there's normal snoring because you're so tired, and your muscles are all relaxed and your tongue is pushing back, and then now it's obstructing the airway, and then obviously it'll make the sound because the tongue is right there.
Yeah,
And then yes, because you'll have sleep apnea, obstructive sleep apnea, where you then find that it's not just snoring, but your airway is really obstructed by your tongue. So what happens is when you're sleeping, your mouth is open, then the tongue tends to drop. When it drops at the back, it goes all the way to your airway obstructing, and then it obstructs your airway, and then that's why you
yeah.
have those sounds.
Yeah, speaking of sleep apnea actually, so would you say like a dentist plays a role in diagnosing or treating it, or is it treated by other doctors?
No, it's a combination, obviously, from the dentist and the physician. I'll also speak to the ENTs as well, you know. So
Yeah,
definitely a dentist, because for us, once we've diagnosed, then we can then treat, you know, with the treating can be the myofunction appliances that really help
yeah.
adults and also babies as well.
Mm. Okay, so what happens if the patient doesn't treat the sleep apnea? What are the effects that will happen to the mouth or oral health in general?
Um, Okay, besides the oral health, I'll talk about the brain function because you're not having enough or sufficient oxygen in your brain. So you'll find yourself
Mm,
with brain fogginess. You'll always be tired. Even if you're sleeping 8 hours, you know, you'll find yourself so tired because your body's not getting enough oxygen and resting well while it's sleeping. Um, Obviously, with brain function comes what's this memory loss, you know, et cetera, et cetera.
yeah.
But let's talk about dental stuff. I'll talk about the dry mouth because most of the time people will open up their mouth, they'll have dry mouth. With dry mouth comes halitosis, which is bad breath. And also with the dry mouth, you'll find that you have increased dental caries, and also your restorations will fracture easily and even more frequently. If you find yourself that you say, dental restorations don't work because I feel my tooth, but the feeling always comes out, then you should be concerned, you know, because most of the time people are not aware that they are having any issues when they are sleeping, you know. And some people find that they have unexplainable tooth wear in general, and they'll tell you, but no, I don't grind my teeth and I don't have stress, you know. So those are the things we check. And then when we check the extraoral cavities, we'll check the jaw soreness, with the tenderness of the muscles. And some will report frequent headaches, especially when they wake up. They'll be like, I couldn't sleep well. I'm having difficulty sleeping. And when I wake up, I always have this slight headache or some dehydration of some sort. You know, I feel dehydrated and, you know,
Mm,
with some headache, you know. And obviously, spoke about the tongue as well, being scalloped as well, like having the marks because of the tongue just pushing against the teeth. And then for those who sleep with their mouth open, most of the jaw is retrusive or the teeth are in an overjet, you know, they're more forward because now when you open your mouth and breathe, the teeth tend to now open the passage for the air to come in because now you're used to breathing with your mouth instead of your nose. And some people even show enlarged tonsils in their
mm.
mouth as well. Yeah.
Okay. Another myth I would love to ask about, because this is currently going around, is that is there a link between sleep deprivation and gum disease or slower healing after like dental procedures, or is that not a thing?
Sleep deprivation and healing. Hmm. There isn't much that I can say about that, you know, but I can, when it comes to healing, let's say for an example, you extracted a tooth and then you might develop a dry socket because your mouth is open when you're sleeping and some bacteria are getting in there. So I think indirectly and directly it is correlated. or the healing is slower because there isn't sufficient saliva to keep the area, with give it enough fluids and the normal bacteria that help with the healing.
Mm.
Yeah.
Are there any um, sleeping positions that you can say, okay, this is a bad sleeping position because it either affects the jaw as to how it develops. Maybe you're dealing with a kid, or maybe it causes TMJ issues and all of that.
Sleeping positions. I know that is. I guess with the sleeping positions, I mean, you have to always sleep on your right side. It's the healthier side, obviously. And I think the best position is you with your mouth closed. I know in physio they prefer you sleeping facing upwards, but the spiritual people will tell you about sleep paralysis about that when you sleep facing forward. So I think
Yeah.
there's so many myths around that, and also preferences according to people. But for me as a dentist, the best sleep position would be with you and your mouth closed. Most probably on your right-hand side.
Mm.
Yeah.
Okay, what signs, if you're, let's say you're doing a dental exam on someone, on a patient, and you do that dental exam, and then what signs during that exam make you suspect that a patient has a sleep disorder?
Funny enough, because some will even snore while you're Uh, so so you can check that, and you can just also ask some questions in terms of the sleeping patterns as well. Obviously, with the dry mouth, they'll tell you that they have a dry mouth. If they're having headaches, they'll tell you. If they're having muscle tenderness, they will tell you. But for me, it would be the truth where that the patient cannot explain. They will tell you that they are not cleansing their mouth. So they don't understand why their teeth are being worn. And then some is the fractured restorations. Yeah, you keep on doing the restoration and the patient keeps on coming back for the same restorations because they are fracturing. So those are the things. This would be an indication for me that this patient has some sleep issues. Also the enlarged tonsils, like I said, the severe overchest of the anterior teeth, or the retrusive jaw, the scallop tongue, the tongue with the marks, when you see the marks on your tongue and the side here,
Yeah,
yeah.
yeah. And then, like, are there like any appliances in the dental industry where they can help patients with sleep apnea, or is it more like your oral health is what's affected, so it's that it doesn't really start this, so that means there can't be anything that can help. I mean, we know with mouth guards and all of that, for stress and all of that. But for sleep apnea, is there anything that you guys can help the patient with?
Yeah, there is some appliances, oral appliances, the appliances you put in your mouth. They look like the night guide for grinding your teeth, but
Mm,
they're quite bigger, and obviously you need to consult because there is a number of them online. You can buy for yourself, but you don't want to buy something that will even cause severe issues as well. So with those ones, we have them. They are called the Mayo function appliances. You can Google them, search them. They help with positioning of the tongue, keeping the jaw relaxed as well, and keeping the airway clear, so you don't know, or there's no obstruction of the airway.
mm.
Yeah.
Yeah, and one thing I found fascinating is every time when I would floss, brush my teeth before going to bed. Like whenever I would sleep, I would probably have like the best sleep ever, which is very weird because you can literally feel that, okay, yeah, I had a great sleep and it's probably because I flossed and all of that. Like, how much does that make a difference to, to someone? Like, how does it affect their sleep? Like, the fact that they brush their teeth, they floss every day, like, how much impact does it have? Is it minimal? And then the other problems are because of other things like maybe deficiencies, or does flossing and brushing your teeth before sleeping like play a huge part?
No, that's a good sign, that you should always brush your teeth and floss. I mean, if immediately you have a nightmare or don't sleep well, just check if you flossed or you brushed your teeth. I think for people who are having difficulty sleeping or having a good night's sleep, maybe they should check that as well. That's a good one.
Yeah, I think that should be investigated because I literally felt that peace. So I guess the fact that my doctor and dentist told me to floss and brush my teeth before I sleep helped me a lot. So
Yeah.
yeah. Anyway,
Yeah,
thank
let me
you.
talk about that. Okay, you can take this however you take it, but let me just explain this. So when you're
Yeah,
flossing, you're removing the food in between your teeth and the gums here. Okay?
yeah.
So if you have not flossed or you just brushed properly, or
Hmm.
just brushed and you didn't floss, just think of the food that is stuck in between your teeth and also your gums. Because what they do is that they stay there and they cause the irritation in between your gums.
Mm.
So when you eat, and you know that when the teeth are not stable, that's why they move. And once you remove a tooth, they can move into that space. So that periodontal ligament that is shielding the teeth, or to call them shock absorbers of the teeth, then
Mm.
whenever you are biting, then they get irritated because there's food stuck in between your teeth. And when they're irritated, they cause an inflammation on your gums, and some pain, and some bleeding as
Yeah,
well over time. So I guess maybe that is corresponding to you sleeping well because you've removed everything that might cause some discomfort on your mouth while you're sleeping.
that's
So,
actually a fair assessment.
pardon me?
That's actually a fair assessment, and it might actually be true, eh?
Yes, yes. So now just think of flossing as wiping your bum. You don't go to the bathroom and don't wipe your bum. So if you haven't
Mm,
wiped properly, do you think you'll be comfortable?
mm. Yeah, nah,
So
that that's actually a way to make people floss. So, guys, whenever you think of you not flossing, just remember you're not wiping your butt. Okay, like it's easy as that. So
exactly, because you wouldn't be comfortable.
that's actually true. I won't lie.
Yeah, yeah, yeah. So
Nah,
it's really important that you floss your teeth, you brush your mouth, and also check on the cheeks on the inside, right at the top of the teeth, right at the back. Also brush the tongue.
yeah,
A lot of people skip the tongue, and it holds so many bacteria and food, and the smell there. You might brush your teeth properly and floss, but your tongue is not clean properly. Make sure you also clean your tongue. Drink plenty of water throughout the day so that you don't have any dryness over of the mouth or the body. Yeah.
yeah. This like has nothing to do with the sleep topic, but then I'm currently seeing a lot of ads on social media being ran about water flossing and that machine that you can buy, and then the water just hits your mouth and all of that. Would you say that's a good purchase, or I know in a way like that'll make them not want to visit the dentist. But would you say like for someone who cares about their oral health, is that a must-have?
I would say a floss is a must-have, and a water floss is a nice to have.
Uh,
Yeah, because I feel like the floss is more mechanical because it goes in and cleans. If there's anything stuck there, it will take it out. The water floss
Mm.
works with pressure. It's more like you have your car that is dirty
Yeah.
and you use the water pressure. It removes most of the dirt that is just superficial on top, that it has not stuck on the car, for an example.
Mm.
But you still need to go with your cloth there and really remove the remaining dirt. So just look at it that way.
Mm.
So if you have
Okay.
both, perfect. Floss, and then you use your water floss on top. That's the way I'll recommend. But don't have a water flosser without a normal floss.
Mm. All right. Now, thank you, doctor, and I hope you guys learned a lot. And I hope you'll have peaceful sleep and wipe your bum, basically floss, right? Because you need to put that in your mind, because that's the only way you will be able to remember that you need to floss every day. It's very important. We know that flossing helps with a lot. If you see on our social media, we talk about how it prevents like cancer and cardiovascular diseases in the future and all of that. So you guys should follow us on social media at smiles underscore dental underscore surgery Instagram, and then smiles dental surgery on YouTube, and yeah, TikTok as well. So thank
Awesome.
you, Doctor. Thank you,
Thank you
Dr.
so much.
Tembeka.
I would say as well that for people who are always exhausted, please, come for a dental checkup. You can never know. We might diagnose something
Mm.
that you really needed to know.
Yeah,
Yeah.
yeah, I agree. Now, thank you so much, and see you guys on the third episode next week. Hopefully, Dr. Buleni.
Yeah, yeah.
Alright, now you heard from the boss, guys. So yes, see you soon, and we hope we helped you so much. Goodbye.
Thank you. Bye.